Hello, I'm Dr. Bolanle, your host on the Bright Minds MD and your mental health podcast. Here, we discuss topics designed to explore the full spectrum of mental well-being. You'll hear from experts and listen to personal experiences that inspire and inform. So, whether you're seeking insights, solutions, or just a dose of motivation, this podcast is your perfect companion. Hit that subscribe button and join us on this incredible journey to mental well-being. Your whole health starts with your whole mind. Let's get started.
Sounds good.
Awesome. Well, hello. Good morning, good afternoon, good evening, whatever time you're listening. Again, this is Dr. Bolanle Akinrambi, psychiatrist and founder at Bright Minds MD, with another episode of Your Mental Health. I'm excited to have a guest here today. We used to work together and at a different point in the past. I'm excited to introduce to you today Dr. Vishnupriya Samarendra, an adult and child psychiatrist. Dr. Samarendra, welcome.
Thank you. Most of my people call me Dr. Priya or Dr. S, so that works too.
Interesting. Okay, and thank you. And Dr. Samarendra, is there anything if you want to introduce yourself briefly for anyone listening and wondering what your credentials are and who you are and why you get to talk about this?
Yeah. So I completed my residency and fellowship. So I did my residency in general psychiatry at Westchester Medical Center, just completed a child psychiatry fellowship, and now I'm attending. I work with kids, adolescents, and adults. Basically, just about everybody.
Everybody, adults and children. And you primarily practice in New York? Like, what do you patients are New York focused, or New York, New Jersey? Still?
Yeah. So I have a New York and New Jersey license, both. But they're in primarily in New York area, and some people in New Jersey who either are close to the border or work in New York.
Awesome. Thank you. And so today our topic is quite hot. What we're going to be talking about is something that's very popular in the media and very heavily, discussed everywhere now. It is attention deficit hyperactivity disorder, ADHD. It's everywhere. I mean, I know that in the psychiatry world, in the adult psychiatry world, at least, there's a lot of conversation about new diagnoses, people who are finally maybe getting answers or wondering about who they are. And if you go in the social media world as well, TikToks and everywhere, it's all the rage. We get so many ADHD referrals. So can you give us a brief introduction or how you might discuss ADHD? What is ADHD?
Yeah, so I mean, it's a very interesting question because it's not really a new diagnosis. I think it goes back to at least a century, if not more. It's called different things, right? It's called hyperkinetic disorder, a number of different things. Or I think previous diagnosis was minimal brain dysfunction at some point. So just as our understanding of the brain is increasing over time with a lot of new technologies, a lot of different studies, our understanding of ADHD is increasing. All that being said, it's the most common diagnosis in young children. Like, it's one of the most common complaints of why kids come to us, particularly before adolescence. And after adolescence, you can have increase in other things like anxiety and depression. And then there's a lot of adults that also struggle with ADHD, but they may not necessarily have been treated for ADHD when they were kids. Or they weren't necessarily officially diagnosed until they were adults, and they're interested in treatment, or they're interested in understanding why things are so hard for them that seem to be easy for the people around them. Something really important to understand is that ADHD is not linked to intelligence. You can have people across the IQ spectrum. So some really brilliant people, a lot of my colleagues actually have ADHD, so it doesn't preclude you from going to medical school, becoming a doctor. So it's across spectrum of intelligence, it's across spectrum of lifespan. It's not necessarily based on your background. We know there's a hereditary component, right? So with a lot of psychiatric illnesses. I think it also depends on the amount of, when we say the word disorder, it's really how much distress is it causing you in your life. So sometimes when people are young, they may be able to compensate for it if they're intelligent. So they miss homework, but they ace their exams. And so they do really well through high school, college. When they come to kind of the real world, there's competing
burden,
responsibilities, burden, right? So someone who was previously doing really well academically, they're now working, they're taking care of a family, they're maintaining relationships. There's a lot of different things going on in their life, and they're pulled in different directions. And what we know about ADHD is that particularly the inattentive component, so the part about regulating focus, so sustaining focus and switching focus, both these things can be very, very challenging for someone with ADHD. And so let's say you're on a work call and you have your child screaming outside, it can be very hard to regulate your focus, right, on one thing versus another. Trying to potentially block out some stimuli that are not as important versus becoming very distracted and losing your train of thought. That can happen quite quickly.
Thank you, Dr. Samarendra. I wanted to hone in on the regulating focus piece, because many times when people show up for inquiry about ADHD, they often talk about inability to focus. And I know I've been keeping up. The more we're talking about it now, it seems the understanding is not really the ability to focus, but I wanted to just highlight the regulating focus piece of it, because I think that's a very subtle distinction that's often maybe missed, but very important, I think, for diagnosis. It's the focus regulation. I just kind of wanted to highlight that because you said it, and I thought it was pretty important to highlight that for people who are listening. It's the regulation of focus, transitioning from one activity to the other. From that, though, we in the adult world, right, there is increased acceptance of psychiatric illnesses, and there's also an increased awareness about ADHD, especially for adults. I want to say that in the past, it used to be thought that ADHD was a child diagnosis, and hence that's where it's emphasized, even in training as well as treatment. But some difficulty happening now, I know, in the adult world, is that there are many adults who had missed diagnosis. Or who were not, diagnosed as children because either their parents were not aware, or especially women, for example, who were thought to be quiet and lost and not diagnosed. So we're getting a lot of those types of people finally saying, aha, this sounds like me, this is my issue. So when they show up to our adult offices, how can we help people like that?
Yeah, I think that's a really important question. First of all, it's not because there's such it's a neurodevelopmental challenge, and to some extent, I read somewhere there was maybe an evolutionary benefit of it, that they were really good at foraging. Whereas us neurotic types were probably really good at knowing where the tiger was that had killed one of us the last time back in our old caveman days. So, everything for a reason, and people can, like with any other illness, be on a spectrum. So there's people who can have subsyndromal symptoms. There are people who can have maybe they can have full-blown symptoms, but they've been able to design a life where they're able to compensate as adults. So I've seen that a lot as well. I think when somebody comes to me right away, it's like something feels off for them. Nobody wants to really talk to a psychiatrist, sorry. Nobody's like, please ask me about every detail of my life. Most of us want to live feeling okay. So on some level. So I think when somebody comes to my office right away, I'm like, okay, well, something's up. What's going on? And so I try to always give people the benefit of the doubt. What
does a diagnosis look like for in an office? I think people are always curious what's going to happen when I come.
So, I mean, first and foremost, I just try to focus on the individual person, because especially with adults, by the time you're an adult, it may not just be ADHD. There may be an anxiety component. There may be a depression component. Sometimes there could be hazardous substance use. You know, a lot of times, even from early on, there seems to be like this obsessional compensation. So the people are repeating their lists to themselves so they don't forget, you know? So
Structure, rigidity.
Yeah, exactly, as a way to compensate. And it's a lot of work. It's a lot of mental work for what seems to be outwardly simple tasks. So first, I try to hear things in their own words. That's really what I try to do. Like, why are you here? What's going on? And sometimes ADHD can present as anxiety. Other times you can have co-occurring ADHD and anxiety. It's very common. Those are common co-diagnoses, right? So I try to first hear about it in their own words. And then I try to rely on certain scales. So if it's an adult, you know, the common one is the ASRS. And then trying to understand what they're looking for. Not everybody is looking for medication necessarily. A lot of people don't want to take medication on a daily basis.
Some people just need skills, right? Especially a lot of highly intelligent adults who already have functional lives who have got ways to manage before they move this with their diagnosis. Some are looking for skills. Is there a direction or resources? And I don't want to put you on the spot if you don't have this off the top of your fingers, but that's a question that we get asked a lot. As far as where do we point people? I've seen some people talking to therapists for ADHD, but I was wondering what else is out there as far as resources that we can share with adults.
Yeah, I think. Or children, yeah. No, I mean, definitely for children, because we know that even if you are on medication, specifically a stimulant, you may need lower doses of that stimulant, which is a good thing. If you can also help, you know, to some degree with executive functioning coaching. So that's one of the things we can send people for. You know, insurance obviously can be an issue, so that may or may not be a possibility. But some, you know, a lot of times individual therapists certainly can help with executive functioning coaching, or, you know, executive skills, these kinds of things. So even some basic things. A lot of times, for example, when I talk to people with ADHD, I ask them, do you make lists? And say, yeah, I make lots of lists. Okay, do you have all those lists in one place or separate places? It's like, well, I have a list for this, I have a list for that, I have so many lists. That's actually not a good idea, because you have to remember to look at each list. So it's actually better to consolidate in one place. Exactly. Yeah, and exactly. A lot of times it's about just adapting to your environment. So a master list, master schedule can be super helpful. There's a couple of manuals out there. I think there's one that's here. See, I can grab it, but there's one. It's a CBT for ADHD.
You can show it if you want to. If it's quick, yeah. I'm sure people are. If it's not handy, maybe we can link it in the show notes later. But I know that usually when people mention a resource, people are curious about it. And
Yeah.
I noticed it was there, and we can show it.
I have
Oh, yay! We got it. Okay.
This one, CBT for adult ADHD, it's by Mary Lisa Lonto, treating executive dysfunction. There's another one that I only have a PDF of.
Is it a self-directed that patients can use on
It's
their
not. I don't believe it's self-directed. I think it is with a clinician, but it doesn't necessarily have to be with a therapist. If you don't have one, a lot of times you can do a lot of psychoeducation during a psychiatric, even a medication management appointment. You can make a little bit additional time if possible. Again, it depends on the institution you work for, the clinic you work for. Exactly.
list them so that people can access them pretty easily. But I'm just going to pull out some gems from what I was listening to you talk about, and you really highlighted, chosen organization, executive coaching as things people can reach for in addition to medications. Speaking of medications, by the way, how much, right? So if we look at symptoms of ADHD, there's, at the core of it, executive dysfunction, regulation of attention. As we're expanding our understanding of ADHD, we're knowing that there's some irritability that could be part of it, part of emotional regulation issues and things like that. A question that comes up often is, how much of this is medication help? Do medications help every single symptom, or
well, I'm sorry, I shouldn't say that. It's a spectrum again. There's three major components of ADHD that we ask about. One is the inattentiveness, which is not known as sustaining focus, but like I said, switching focus. So I'll ask things like, how often is it that you have how often you have trouble wrapping up the final details of the project once all the the fun, challenging parts are done, and you just have the boring parts left. For impulsivity, we ask about, how often do you interrupt people? Not like purposefully because you're disrespectful, but because you just you finish their sentences for them, or in social situations you find yourself talking about. Some of it could be anxiety, some of it can be just that there's an impulsive component that you act before you think, right? And then there's a hyperactivity component. Now, as people get older, the hyperactivity component we know can get a lot better outwardly. What may be happening is because some of it may be related to part of your brain called the basal ganglia, that it's a lot of internalized movement. So the planning part of movement is just kind of going, what do I do next? So you're not acting it out the way a child is, because it's become, inside you, but it's internally there. And so outwardly, people are not necessarily as hyperactive once they get into adulthood. But the inattentive component can certainly persist into adulthood and can often cause the most problems.
Thank you. So those are some of the domains of symptoms that we look at. So do medications help all of them, or is it a combination of medicines and other things?
They can. I think a lot of times if someone has primarily inattentive symptoms, they say, okay, I can handle the rest. It's really going to really help me focus. Sometimes I try to, especially with adults, I try a non-stimulant first. There's multiple reasons for this. Maybe if they have a co-occurring medical illness, I need friends and they're like, don't touch me, what's wrong with you? You know, these things can be hard for a kid and they can internalize some of that.
So bringing therapy on together with medication treatment overall improves the outcome, at least for children, and I think adults too, because I meet adults who have these beliefs and ideas about themselves, and scattered and whatever. You know, these I am labels based on the lifetime of having ADHD symptoms and potential criticized. And so therapy, great point that adding on therapy to medications improves outcomes, I would say, across the board. All right, so thank you very much. I don't want to leave without giving the opportunity. Are there other things that you feel like we should definitely mention before wrapping up today? We touched on the most important pieces of this conversation. I think thank you very much. And just to summarize, right? We talked about ADHD today. We talked about symptoms. We highlighted tools and strategies. You know, medications, executive coaching, tools, adapting yourself or adapting your environment to how your brain works. We also highlighted that ADHD runs across spans of intelligence and it's a spectrum illness. And definitely, if someone is wondering if they do have it, definitely speak with an expert. And that's typically an assessment with a psychiatrist who is conversant with taking that diagnosis, and this is done by a clinical exam as well as use of scales such as the SRS. I can keep up personally to really try to get to the bottom of it and get help. And we know that a combination of medications and therapy give us potentially the best outcomes. All right, that will be all for today. I want to thank you so much, Dr. Samarendra, Dr. Priya, for taking the time to share with our audience today. Where can people find you? So, I heard that doctor speak, and I want to go and look and maybe, I want to hear more of what they have to say. Where can they find you, whether out in the world professionally or in social media, if you do that?
Yeah, I mean, a lot of my social media is mostly just for my arts and crafts.
You gotta have outlets.
Yeah, exactly. I'm on psychology today, so if someone is interested. And I work in New York. I work for Mount Sinai, but my views are my way to it. So,
but they can definitely call and make an appointment.
Yeah.
See you for an assessment.
Exactly.
Thank you so much. And of course, we'll always add that everything we heard today is for education and entertainment, and no medical advice given today. So please reach out to your doctors or schedule with Dr. Priya for an assessment. You can find her online. And of course, we at Bright Minds MD also provide psychiatric assessments as well for adults with ADHD. We can be found online at brightmindsmd.com. That's BRIGHTMINDSMD.com if you'd like to schedule an appointment. That'll be all. Thank you, everyone, for participating and listening. And again, thank you, Dr. Priya, for sharing your knowledge with us today. Have a wonderful day.
Thank you for listening. Don't forget to share this with a friend or two. Until next time, it's Dr. Bolanle on the Bright Minds MD and Your Mental Health podcast. Ciao.